They call them routine checkups, but for women over 70, some of these so-called preventive tests can quietly do more harm than good. Radiation exposure, false positives, unnecessary drugs, even procedures that trigger lasting damage. A 2021 study found up to 42% of older adults received at least one unnecessary test that caused avoidable harm. So before your next appointment, here are 5 tests to question, starting with one your doctor probably never warned you about. Number 5. Bone density scans. For women past 70, bone scans often diagnose osteopenia, a mild bone loss that's completely natural. The danger? Over 60% of these women end up on harsh medications that can cause jaw decay, ulcers, and spontaneous fractures, even when fracture risk is under 3%. The test compares your bones to a 30-year-old's, not your peers. If you've never broken a bone and feel stable, skip the scan unless symptoms appear. Gentle resistance training twice a week can strengthen bones naturally, no radiation, no pills. Number 4. Annual blood panels that miss hidden kidney decline. Most routine blood tests check kidney health using a marker called creatinine. But after 70, lower muscle mass can make this number look normal even when kidneys are struggling. A 2022 study found 35% of older women had kidney disease that standard panels completely missed. The safer test is cystatin C, it's far more accurate for seniors. Ask for it by name. It could prevent toxic prescriptions and fatigue before it's too late. Number 3. CT angiograms. Heart scans using contrast dye are powerful, but risky. That dye can quietly strain aging kidneys and, with repeated scans, even double dementia risk over time. A 2021 study in stroke found older adults exposed to multiple contrast scans developed vascular brain damage at nearly twice the rate. For mild chest discomfort or fatigue, safer options exist: a treadmill ECG or a calcium score scan, both without contrast. Always ask, is there a lower risk alternative? Number 2. Routine pelvic exams. Millions of women over 70 still get yearly pelvic exams, even with no symptoms. But research shows no benefit in preventing cancer and significant harm from false positives. One small cyst can trigger a chain of ultrasounds, biopsies, even surgeries. In one study, 63% of women over 65 had at least one unnecessary follow-up. If you have pain, bleeding, or pressure, yes, check it. But if you feel well, skip the routine exam and choose a symptom-guided approach. Number 1. Colonoscopy past 70. Colonoscopy saves lives in middle age, but after 70, especially if past results were clear, it can be dangerous. The prep causes dehydration and electrolyte loss, the sedation can affect memory, and infection risk skyrockets. One study found sepsis risk increased 12-fold within 10 days of the test. Non-invasive stool tests like FIT or Cologuard now detect colon cancer safely, at home, with no sedation or gut disruption. Conclusion: smart screening, not more screening. These 5 tests, bone scans, routine blood panels, CT angiograms, pelvic exams, and colonoscopies, have their place, but only when they're truly needed. After 70, prevention isn't about doing more, it's about doing wisely. Ask questions. Know your risks. And remember, the most powerful form of prevention is personalized care,